The next thing I want to talk about self-advocacy that I wish that someone had told me early on relates to research and clinical trials. I just talked about the PubMed. There is also too an important URL which you need to know about, and that is clinical trials. I'll make sure that there's a link in the show notes today. Clinical trials are not the last resort for you guys. And this is what I wish that someone had told me early on. Actually, I went to the Hope Summit by Longevity, and there were a group of stage 4 cancer survivors on stage. And you guys, I will never forget that. And they said, okay, what is your best piece of advice? What do you wish that somebody would have told you early on? And they said, look at clinical trials sooner than later. Why? Why? I'll tell you why. And this I learned from actually being on a clinical trial myself. You will have a lot more ease of actually qualifying for a clinical trial early on in your diagnosis than you will later on. You should utilize absolutely the most innovative and the best research and the cutting edge therapies early on in your case, not later when it's a last ditch effort. Okay. So research those clinical trials, bring it up to your oncologist. Actually, I had to with one of my oncologists. My oncologist didn't even mention clinical trials, never spoke a word about clinical trials. I had to go to that longevity center, go to that Hope Summit, and find out about clinical trials on my own. This is the part about advocating for yourself. Do not be afraid to talk to your oncologist about clinical trials and your cancer center. And if you can't find the information there, go search for a second opinion, learn what clinical trials you qualify for, even if you have no intentions about doing them. You need to have that information in your back pocket. It could potentially save your life.